Assalamu alaikum. Last time we talked about the introduction about lesson number 13, that's LUMOS. Okay, what does LUMOS do? Today we will talk about that. What is the function of LUMOS? LUMOS is a charity, it's an institution that provides help to the children and their families. So what is actually the work of LUMOS? What is the function of LUMOS and what does it do? 8 million children worldwide are living in institutions because they are poor, disabled, or from an ethnic minority. So about 8 million children in the world are living in institutions. What are the institutions? Institutions that are meant for what? That are meant for disabled people, that are meant for poor people, that are meant for those people who are from ethnic minority. Ethnic minority means that is connected to a nation, race, or people. Ethnic means which is connected with the nation, okay? And ethnic minority means the persons that are very less and belong to a particular nation or belong to a particular race, okay? So 8 million children worldwide are living in institutions because they are poor. Why they are living in institutions? Because they are poor, disabled. Disabled means one who is not physically fit, okay? One who is physically disabled, handicapped, or from an ethnic minority. Ethnic minority, I have already told you. This is a serious problem on a massive scale, but there is a solution. So this is a serious problem on a massive. Why this is problem on this is a problem? Why this is a serious problem on a massive scale? This is serious problem because children are the builders of nation. Children are builders of nation, and when this young community and when these children are in institutions without any proper care, so it becomes a massive problem. It becomes a serious problem, but there is a solution. So as we are already being taught in our schools, as there is in Quran as well, that to every problem there is a solution. हर किसी इसका मुश्किल का कोई ना कोई हल होता है, but the human beings have to be patient. There is a solution to every problem, but what we have to do as a human beings? We have to work hard to find that solution. We have to try to find that solution, okay? But there is a solution. And what is the solution? LUMOS works in partnership with governments, professionals and carers, communities, families and children to transform outdated systems that drive families apart. So LUMOS works in partnership. Actually, LUMOS, maybe it's an NGO, okay? It works in partnership with governments, with professionals, with those professionals that are associated with these institutions, okay? Or with those professionals that, for example, who take care of the children, okay? Like teachers, okay? Who can teach those children, like doctors who can take care of these children, and many other professionals. They work with these professionals and governments and carers. Carers means one who takes care of someone, okay? Communities, families and children to transform outdated systems that drive families apart. They even work in partnership with children. They work in partnership with families. They work in partnership with communities, okay? To transform outdated systems that drive families apart. They have to transform that outdated system. What is the outdated system? The outdated system is the institution where children are kept apart from children are kept away from their families without any proper care, okay? And where they are kept in institutions that drive families apart from children, okay? The family doesn't have any concern with the children. The family, the children that are kept in institutions, the family is not concerned about them. But this LUMOS works with communities, works with some professionals to transform this outdated system and brings family together with what? And brings this family together with the children and brings this family closer to the children. Together with their partners, LUMOS replaces institutions with community-based services that provide children with access to health, education, and social care tailored to their individual needs. So what does LUMOS do? It replaces institutions, those institutions where children don't get proper care, with community-based services, those services that are community-based. Community-based means that are done with the help of a community. Okay, the services that are supported by community, that provide children with what? Access to health. Those children that are kept in institutions, this LUMOS works with community-based. This replaces these institutions with community-based services that provide children with access to health, and in these community-based services they are given this access to health, education, and social care tailored to their individual needs, that are fitted to their individual needs. For example, some children need health, proper care about their health, so they are given the treatment. Okay, some need education, so they are given proper education. Okay, some are physically disabled, so they need, for example, there's a blind children. Can he read or write? What does this community based services do? They provide braille system to these blind children. Have you heard about braille system? Braille system is actually, it's a device that makes blind children able to read and write, so fitted to their individual needs. For example, a blind person, what will he do with the books? He cannot read books. So what does the LUMOS do? It provides braille system to the these blind children. And same with deaf people, same with those people who cannot who don't have hands, who are handicapped physically. What does they do? So accordingly they provide needs to these children according to their individual needs. Whatever they need, LUMOS provides them with the help of community based services. This supports families to provide the loving care their children need to develop to their full potential and build a positive future for themselves. So what does this do? This supports families. Which families? The families of these children that were kept in institutions. So this supports the family, and this helps family to provide the loving care their children need. When these children are brought out of the institutions, what happens? They are brought closer to the family, and what does family do? With the help of LUMOS, they provide loving care to their children, so to develop to their full potential, so that these children develop to their full potential. जितनी उनमें सलाहियत है उतनी तक उनको लव और केयर देना, to their full potential, and build a positive future for themselves, and build a positive future for themselves, for the family, as well as for the children. We will stop here. I hope you have got this much, this paragraph. Till then, stay at home, stay safe, take care of yourself. Allah Hafiz.